Welcome to this edition of Pass the Mic, Let's Talk, an initiative of the Africa Center for Ideas program through Jade Communications. It is part of a series of conversations on the impact of the COVID pandemic on Kenya especially, but with reference to the rest of the continent and on the world at large. I'm John Sibiokumu, and my guest is Dr. Alex Awiti, Vice Provost of the Aga Khan University. He is a systems ecologist and public policy analyst. And for 14 years, he has been a weekly columnist for the Star newspaper. Welcome, Alex, Daktari, if I may.
Thank you.
Alex, given your academic and journalistic competencies, let us focus our discussion on the grand title of Adaptive and Behavioral Approaches for Regional Recovery and Transformation. Let's put that elaborate diction into a bit of people speak and say we're going to talk about how we are to cope as human beings with this ongoing pandemic, already with us for more than a year, close to 2 as we speak. So here are some facts with which you're well familiar. This is the status of COVID-19 in our country, Kenya, at present. Over 240,000 infected, nearly 5,000 dead, less than 4% are partially vaccinated, only 1.7% are fully vaccinated, lower than the 2.5%, which is the proportion of those vaccinated on the whole of the continent. 4, access to vaccines remains worryingly low. The government's efforts to procure and administer vaccines is underwhelming at best. 5, surveillance and contact tracing efforts are virtually non-existent. Hence, we should brace ourselves for frequent and deadly surges across the country. 6, there is pandemic fatigue. People have had enough. They're tired of lockdowns, they're tired of social distancing, they're tired of wearing masks. They want to go back to the lives that they led before the pandemic hit us. So those are the facts. But our focus is on people's response. And in the next so many minutes, perhaps I could hit you with some trigger words and see your response, and that will inspire me to perhaps come back to what you're saying. Vaccines.
So vaccines are the best tool that we have in the toolbox today, but it is not a universal panacea to ending the pandemic. There will be no such a thing as the end of the pandemic. In fact, we're moving into the endemic phase of the COVID-19 disease. Vaccines will absolutely protect those who are vaccinated from critical illness and death. But individuals who are vaccinated will still transmit the disease and will still be infected. So we still have to go back to the old things that we're tired of, social distancing and wearing masks and hand sanitizing.
Dr. Given, understood, but we don't have enough vaccines. I read in the papers that we should be thoroughly glad that we've been given another 805,000 cachets of a population of 47 million. We've given the dire statistics. So you're telling me we need this, and I'm telling you we don't have it.
Yes, the efforts are sporadic at best, and we are in a tough regime of inequitable access to vaccines. The West basically hobbled and has been hoarding huge doses of vaccines. For instance, Canada can vaccinate its population 5 times over. And as you said in the very beginning, only 1.7% of Kenyans adults are fully vaccinated. And this is still lower than the African average of 2.5% of the African
Well, that's a
population
conversation for
vaccinated.
another day and another guest, perhaps. We're talking about my behavior as a human, two eyes, a nose, teeth, etc., etc. I have a great desire to be vaccinated. Do you think, obviously you're not a government minister, you're not a policy maker, do you think that we will get round to consciously responding to this pandemic, or do we more or less take what's on offer? Well, and if, you know, God forbid, if it's my turn to die, then I should say, Daktari, it was nice knowing you, I've got it now, got no access to oxygen, please arrange a marvelous funeral.
No, it shouldn't be that way. So one, there are tremendous advances in therapeutics in terms of what we can do with patients who get COVID in our hospitals today. But vaccines and these what we call non-pharmaceutical interventions, which include mask wearing, social distancing, sanitizing, and etc., are still critical. But the government's efforts are still, you know, at best deplorable. And the fact that we've basically resigned ourselves to the fate of COVAX, this global initiative to give Africans vaccines, is just pathetic. I think our government needs to put up a tremendous war chest of resources to procure vaccines for its population. And I think there's going to be something
to say, dear Serikali, help us, oh government. I think it is unfair to blame government. Let's go for an anecdotal, an image there, an analogy. Mm-hmm. If I'm a parent and my child, for some reason, wants to eat chips, and saying, Daddy, please give me chips because I see everybody else, you know, my neighbor next door, their kids eat chips every day. And I'm saying we as a family cannot afford chips. Is that a great lack for people to say, get your act together and make sure that your kids, it's unfair. It could be said that the government just doesn't have the wherewithal and the capacity.
I would not believe that, because I think our government spends money in horrendous ways in other things that are not important. This is a public, health crisis.
You've made a damning statement. Could you name an area of spending which perhaps should be shelved to prioritize COVID pandemic now?
Yeah, you know,
Would you be so bold as to tell the government?
The profit gets spending on per diems and night-out allowances for government officials, for instance. There's a lot of unaccounted for advances to public offices, which are declared by the Auditor General every year. There is, and the President has admitted this, our public service is bloated. There is a lot of wastage in public expenditure regimes. And I think what the government should do is to sequester a lot of these resources to deal with a critical public health crisis, which is basically eating everything that is productive to generating the wealth that we need to build the economy that we have.
May I move on to another key word, and that is the whole idea of variants. Yeah. And again, the critical thing is nilikuwa nimejipanga, I could deal with COVID-19 as it came in through the thing, and then we had a whole set of variants, Alpha from the UK, Beta from South Africa, Gamma from Brazil, Delta from India, and now come January 2021 we have MU from the United States of America, which seems to me that there could be one which emanates from Kenya. There could be KU, which is our death-destroying variant. So again, I know it's rather unfair on you, Daktari, but with this idea, I mean, who are you to know? But what are your views on the idea of our readiness to confront a multiplicity of variants?
And that's exactly why I say that we're moving into an endemic phase of the pandemic.
What does endemic mean?
Endemic means now it's like the common flu.
It's
the common cold, that it's just ubiquitous. Anybody will get it and we just get used to it. So the novelty of the disease is the reason why we confide the label pandemic. It is moving into a non-novel state. That means that it is just anything that you could encounter like a common cold. But to your point about these variants, the reason why we have this inescapable risk of new variants emerging is because we're not serious about vaccinating the entire world. And the West now has realized that hoarding those vaccines, trying to create a fortress of vaccinated people in their countries is not going to work, because we are extremely mobile as humans, and one unvaccinated person anywhere in the world is a threat to vaccinated people everywhere in the world. So the global effort should focus on vaccinating 100% of the global population. Now, inequitable access vaccine hesitancy, incapacity in governments to basically roll out vaccines even when they're available is a present danger to the emergence and a trigger to the emergence of new variants. So for as long as we have huge swaths of the population unvaccinated, these new variants will emerge.
Right. Well, you've sort of preempted my next trigger words, and they're herd immunity.
Yeah.
Now, you're saying this is a totally fantastical construct.
It is.
The herd will never be free of this thing. Therefore, again, let's focus on not the blame game of, why should those awful people not make it available to us? What are we to do? What am I to do if I drive from here to Nyeri, if I drive from here to Mombasa, if I drive from here to Kisumu, or perhaps I can't drive, let's say I walk there as a mwananchi? What am I doing as I go through these various boundaries to help in the struggle? Am I to stay, as the word you used earlier, sequestered rather, in my own village forever ad infinitum for the next conceivable, maybe I'll live for another 30 years?
No. I think what we need to do, we need to basically figure a path to normality and away from a path to the herd immunity thing, which is kind of like, as I said, a fantastical construct. The reason why we cannot
I'm going to, our behavior.
Yeah.
I'm going to tie all your analytical and scientific analysis to behavior.
Absolutely.
Now, the idea of having a lockdown that lasts from this hour to that hour, that I find, it's all very nice for the think tanks to come up with that. It's a very nice idea, but I don't see why that arbitrary choice is of ours. And I'll also tell you, as a matter of self-confession, whatever it is that within a certain social stratum, there is the possibility to thoroughly ignore those curfews.
Absolutely.
To zoom up and down, get totally plastered on various, and on the way home, hand over a 500 shilling check.
Yeah.
So is this me positing myself as the most evil Kenyan who has ever lived, or is it me positing myself as somebody who behaves like lots of other people I know?
So,
and you're saying, you said to me, if we find a way as a nation to respond to this, everything will be better, if not fine.
So to go back on the behavioral predicate that you created, as humans, we're just tired. It's been nearly 2 years into this pandemic. We're tired of lockdowns. We're tired of quarantine. We're tired of wearing masks. We're tired of social distancing. And it is normal for us to behave that way. The question is that therein lies the danger, and that's where we need to have a very honest conversation about some of the measures that we have to continue to take. And everybody understands that this is a deadly disease. If you catch it and you're unvaccinated, the chances that you'll be critically ill are very high, and there's also a chance that you might die from the disease. Now, these choices are as stuck as they are, but humans still ignore these things. It's like there's some kind of suicidal instinct in us. But I think the idea of we can't lock ourselves down out of this problem. We've got to figure out a sensible transition to sensible measures of self-protection, wearing a mask, social distancing. We have to drum these discussions into our communities as long as this disease exists with us.
Dr. Harry, the formulation that you've used, which I'm going to push back on, is this idea of figure out. When we read the papers, about how other people are behaving, when this pandemic hit China, for example, apparently you could be having a whale of a time in your little flat somewhere, and the cops would come and knock and say, hey, Dr. Awiti, off you go because you've broken the rule. Yeah. They've said, if you're going to go shopping in a family, only one person from this family. So this whole a plethora of responses which are mean and dictatorial and say, you're out. Now, we live in a society where you can circumvent the edict by corruption. So if there's endemic corruption, then it's hard to enforce. Yeah. And then you also have the idea of lack of education among our people in the more far-flung rural areas where life goes on as usual. The idea of a virus, people in my particular home or village, Home Squared, my aunties are forever telling me that they're suffering from malaria. One auntie's down with malaria, they recover, 2 weeks it's TB. So the idea of a world of suffering is also part of our lives. Yeah. Now you're saying this is a different type of thing, and they're saying this is the way we live. Shauri ya Mungu, bora uhai, hit me with your rhythm stick, I'm ready to die of COVID.
Yeah.
So that's what you have to fight against.
So there's two endpoints to that debate. You have China on the one hand, and then you have liberal democracies like Australia, for instance. That, Prime Minister Morrison, for instance, imagined that they could get to zero COVID. He since said we've got to figure out how to live with the disease. China has not been tremendously successful. They have not eliminated the virus from their country. So initially when it all started, everybody thought the dictatorial regimes were probably much better at dealing with this pandemic. No is the answer. They have not been extremely successful. They have not eliminated the disease from their shores. And even liberal democracies have attempted some really draconian movement and mobility constraining measures, and they've basically given up and say we have to come out of the cave. Those are the words of Scott Morrison. And that's what we're saying. We cannot hide from the pandemic. We have to do two things simultaneously. Do the non-pharmaceutical interventions, which is the mask, social distancing, sanitizing, etc. And we have to roll out a massive campaign to vaccinate a huge number of the population to prevent people from dying from a disease that is preventable. COVID should not be a death sentence.
How do we impose solution number one, which is wash your hands, wear the mask? Dr. We're not doing these things.
We're not doing these things because...
we're not doing this for fear of the way in which the society responds. When I have somebody who comes to help in our household, she would say to me, the other day my son was waylaid in Kayole, and the cops came to him and said, you're not wearing your mask up to covering your nose. Unless you give me Kenya shillings 1,000 only, you're going to sleep in a cell. Then I have friends who live in Karen, and they would come and visit and say, Mwalimu, I'm off now. It's 10:30, but I'm going to drive all the way to the leafy suburbs of Karen, and the cops will say hello to me on the way. Double standards, class standards, social standards. So figure it out. I'm still coming up on your key words, figure it out. But we're not figuring anything out.
So I'll be extremely brutal.
Yes, do. I love brutality.
On some of these measures. One, I think these lockdowns and curfews are nonsensical in our context because we're not implementing them as we should because of just the inadequacies and the corruption that gets injected in the enforcement part of the thing. The other one is how the virus spreads. In tight quarters, of course, you must enforce strictly use of masks and social distancing. Now, out there in the open, the risk of spreading the virus is very limited, especially at a certain distance threshold. So this kind of idiotic kind of strict enforcement of you have to wear your mask when somebody's walking out in the field. When I take a walk on Sundays in my neighborhood and I'm very far away from people, I take off my mask. When I approach close proximities with people, I put back my mask. So I think there has to be an element of public education, and the Ministry of Health and the public enforcement of this should also be sensible. Some of these things just do not square with the science of the transmission of the virus. This is a respiratory virus, and it spreads through respiratory droplets, and proximity and distance and close quarters where there is limited ventilation do play a role in exacerbating the risk of spreading. And our folks just need to understand the basic science of the spread of this disease and stop enforcing wrong-headed measures that just constrains people's personal liberties.
Dr. I think you've dealt with two of my things, but I'll allow you to expand because I had vaccine rollout and campaigns. Would you add more, or shall we move on to the next buzzword?
I think the campaign part is important. And I think one of the other points that you mentioned at the top of the discussion was surveillance and contact tracing. We're not doing any of these things. And this is the only way we can prevent the disease from spreading and emerging in new hotspots across the country.
Is this an area where devolution is a great hindrance? Because if you have devolved systems of government, you've most possibly got devolved responses to the thing. So we're not responding nationally, because one thing could be happening in Kakamega County and the other could be happening in Marsabit County.
Yeah, but you see, when it suits us, we've basically nationalized public health. You know, who is at the face of public discourses on this? It is Cabinet Secretary Kagwe, where the governors across the counties giving updates on COVID in their own counties and enforcing those measures. On that front, they don't have the tools and resources to do exactly what we are talking about. The public education has been renationalized, and Kagwe pontificates every other day about what people should do. And it does just make sense because he doesn't have the reach and the depth to the rural communities that are being pummeled by this disease now, as was in Western Kenya and now is in Central Kenya, for instance. Why is there such a huge absence of the counties when it comes to being at the front line of the public education and the public campaigns to basically enforce some of these non-pharmaceutical measures to prevent the spread of the disease?
I'm going to go on to business and the economy.
Yeah.
Now, do forgive me, I'm not an economist, but those who supply me with research would tell me that we have budgets, and basically, from the layman's point of view, the budget we had last year in 2020 is going along the same indices as the budget that we've had this year, and there's been no change. So if you haven't rejigged the budget, how can you reconfront the pandemic?
Well, so over the last year, for instance, 2020, as early as June, the government put aside a stimulus package. There were reductions on pay-as-you-earn taxes for individuals to create some relief as the full effect of the pandemic on the economy was unfolding. But we had not telegraphed exactly where this was going to land. But you've seen, you know, the tourism and hospitality pummeled to non-existence. Education sector, which is a huge employer in this country, you know, almost in smithereens. Schools closed, teachers were laid off. We saw these heroic stories of schools being converted to poultry raising operations, etc. And the government did not come back with a full-throated mechanism to basically undergird these critical sectors in the economy. So we're firing on less than the number of cylinders, as you said. If you compare 2019 to 2020, those revenue inflows into the government have basically been curtailed. But we have not gone out to basically create a special vehicle to inject new impetus and new resources to the economy to bring back people in employment, to bring back payroll to the levels that it should have been. And that also affects spending. We're not spending as much as we spent in 2019. So the elements of the retail sector, wholesale sector of the economy, they're really suffering. And those are the sectors that basically generate the revenues that the government then collects to put back resources into supporting the economy.
So you're saying basically, Daktari, that we can have as many newspaper headlines as we want. We can go from bottom up, and we can promise that in 2022 there's going to be a government that's going to revive the economy. But COVID is the great leveler. You're saying that all these are empty promises to the people because we're not going to go bottom up or up down, whatever we choose, in the foreseeable future.
No, the productive elements of the economy have been totally pummeled by COVID.
Yeah, but I'm trying to see the political aspirations, all our rallies, people meeting on a Sunday in Muranga, zooming off, you know, megaphones, talking to the people and saying, promising the youth they're going to have jobs as of a date next year, the next elections. I'm just saying, shouldn't our people be wise enough to see beyond what is basically a political lie? Yeah.
So we're getting deep into the silly season, which is electioneering and the campaigns. There's going to be a lot of lies and falsehoods that are being peddled by politicians about what they can and cannot do on a campaign platform, create jobs from thin air, resuscitate the economy from a zero base for growth, and all these things. I think we're staring at a very serious economic crisis. And rolled into that will be a serious social crisis. And the politicians are not going to speak about that because that's going to scare the bejesus out of the electorate. And the question then is, who would be most suited to basically get us out of this rut? And I think that the next government, just like this government should, President Kenyatta, before he leaves, should put the economy on a firm path of recovery. He should reprioritize spending and government policy priorities to basically focus on recovery, on deep recovery of the sectors that basically should pull us out of this. Tourism, hospitality, education, and stimulate public spending. And how is that going to happen? We're not getting great answers from the Treasury. Neither are we getting great direction from the President.
Daktari, the last question, because we have constraints of time, to make this conversation slightly more Africa-wide. I'd like to end with this idea that somehow we, indigenous Africans, have a kind of built-in biological mechanism to make these diseases give us a wide berth. So sisi wa Afrika hatuwezi kushikwa na, and the idea that, do you think that given what's happening elsewhere in the world, is the continent doing well or badly? Are Africans behaving badly, or are we doing the best we can?
So there's two things in there. One has been the original myth when this discussion started about how Africa was going to be completely devastated by the COVID vaccine, predicated on two issues. One is that our healthcare system is non-existent. You know, we saw what happened in Lombardy, in Italy. We saw the New York health system basically break down. We saw the catastrophic collapse of the public health sector in Brazil. Everybody thought that was coming to our shores. It didn't happen. Now they're wondering whether we are not counting the numbers of dead and infected correctly. The other myth that was spread was that the BCG vaccine that we get as little kids basically confers some residual immunity many years later. And the other one is that we don't live in such horrendous densities as most people in the West live, and in China, for instance. In the far-flung villages where you and I come from, the densities are not as high. And if you look at the pattern of the disease, it's Mombasa, it's Nairobi, it's Nakuru, it's Kisumu, it's Eldoret. That has been the path of the pandemic in terms of infections, in terms of fatalities. And the villages have been spared because they're just not large masses of people congregating. And as we said, this is a respiratory disease, and it spreads through contagion and very close proximity. So the jury is still out there, whether it is true that Africa has not been pummeled as was the case predetermined, or Africans are just undercounting the numbers. But one of the other things that we need to think about is that the incidence of chronic illnesses that then undermine immune capacity in individuals, such as diabetes and respiratory diseases, those are not as widespread. Things like obesity are not as widespread on the continent as they are in Brazil, for instance, in India, for instance, and in North America, for instance, where people of color, such as you and myself, have been pummeled the most. In New York, for instance, and even in Brazil, is among the colored minority communities. Here, there's a ton of Africans, and they're not dying in huge numbers, and they're not getting sick in huge numbers. So the science is still very imprecise, and everybody thinks that Africa is a big data hole, and we're not properly counting, even in our country. Those numbers, 240,000. Many people doubt that that's the real number. 5,000 dead. I talk to people who seem to imagine that those numbers are lower than what they're hearing from their colleagues and relatives in the villages, of funeral after funeral, and most of those are related to COVID, especially in the past 6 months.
We have to end there. Daktari, thank you for those informative and, dare I say, bold responses to my questioning. And thank you for either listening to or watching this edition of Pass the Mic, Let's Talk, an initiative of the Africa Center for Ideas program through Jade Communications. Till next time.